Hello, this is Steve Federico, General Pediatrician and Director of General Pediatrics at Denver Health. So I was reflecting on my drive into work today that for the very first time, I'm excited to be fighting against school traffic. The 21-22 school year is off and running, and for the first time in well over a year, the vast majority of our students are in person, in school, with each other, with their teachers, learning in a way that is predictable. And that has so much power when it comes to not only the academic performance of our kids, but their social-emotional development as well. And I'm so excited and so proud of our effort to kick off this school year in a successful manner. Now, we're only going to be successful if we work together. Continue to vaccinate the portion of our community that's not vaccinated, continue to wear masks inside, and not coming to school when we're sick and getting tested. And together, we can continue to have a successful school year, maximizing our in-person learning days. There'll be bumps on the road ahead, and we'll work through them together. But I'm super excited to be part of this effort and could not be more excited about our early start here in 2021. With the mitigation measures that we've put in place, that schools are safer than they've ever been amid the pandemic, and that the mitigations measures we put in place, when followed with high fidelity, work extremely well in decreasing the spread of COVID. Now, many of those measures rely on us as a community to participate. So the first of which is, when eligible, get vaccinated. We've done a great job with our adolescent vaccination rate in Denver County. It's close to 70%. But that means a third of our teenagers still aren't vaccinated. So we need to finish the job and get the rest of those teenagers vaccinated. The second that we play a big part in is not coming to school when we're sick and getting tested as soon as we get sick. Those are two important measures that we as parents and students play a part in. And then the third one is wearing our masks. When we do those three things, schools are a reasonably safe place to be. What we have seen is that unquestionably the Delta variant is more transmissible. It goes from one person to the next in a matter that is much, much faster than other variants, which is why we've seen some people who are vaccinated get COVID. Now, what does not appear to be the case is that if you get it, that you get necessarily sicker. It's a little bit confusing, I understand, but the main difference with Delta from the other variants has been the ease with which we infect each other, not how severely affected we are. Now, the question has also come up around kids, and there's lots of data in the press now that we have more cases amongst kids than we've ever had before. And we think that that's because of two reasons. The first one is, of course, kids represent the biggest group of people who are not vaccinated, because kids under the age of 12, of course, are not eligible for a vaccine. And so they are out in the community and have this risk of becoming infected. The second is because Delta is more transmissible. So if it's easier to infect one another, then you're going to see more cases amongst people who are not protected. So if you are one of the few people in Denver who are not vaccinated, you need to do so. And amongst our pediatric population, we've got to be very intentional about masking and doing our other mitigation measures to avoid transmission amongst that group. The scientific evidence around the COVID vaccines remains incredibly strong in terms of the efficacy with which they protect us from severe illness. It has consistently been shown that the people who are vaccinated have a tremendously decreased risk of being hospitalized and or dying from COVID, which is ultimately what they're designed to do. You're still less likely to even get COVID, much less likely to get COVID, even during Delta if you're vaccinated. But with Delta, we are seeing more breakthrough cases. So I do hear from many folks in the community. I know somebody who's been vaccinated and they still got COVID. And that is, of course, unfortunate. But in the vast majority of those cases, they are much less severe cases than they otherwise would have been. And it's represented by the people who are in the hospital. Over 90% of the people in the hospital are unvaccinated. So does the vaccine work? Yes, it's an incredibly effective vaccine, arguably one of the most effective vaccines that we've come up with in recent history. As a pediatrician who's worked with schools for well over a decade, I'm always concerned when we don't have enough school nurses in our schools. They play a vital role in helping to keep our kids safe, whether we're in a pandemic or otherwise. So it is concerning that we have a nursing shortage in our schools. It puts the burden on other school leaders to figure out when our students are too sick to be in school and when it's okay to come back. So it increases the burden on us as parents and healthcare providers to make sure that that we know currently during the pandemic, if our kids are sick at all, they need to stay home. And if they're showing any symptoms related to COVID, especially the fever, that they need to get tested right away. And we can really help out our school communities if we do those things.